Hello, I'm Dr. David Pate, President and CEO of St. Luke's Health System, and I want to welcome you to the 2012 Fall Forum. At our Spring Forum earlier this year, we reviewed our strategy and initiatives for the upcoming year. And at the last Spring Forum, I spoke to you about our strategy for accountable care, our plans for Medicare Shared Savings Program, our success with the Healthy You program, and our My St. Luke's implementation. My plan for today is to update you on how all of the initiatives we have been undertaking, which may have appeared to you at times to be disjointed, all come together in a very exciting way to make providing accountable care a reality. I want to start by reminding you of our mission: to improve the health of people in our region. Today, under a fee-for-service model, our focus is to improve the health of sick people. But tomorrow, under accountable care, we will truly be able to fulfill our mission of improving the health of everyone in our region. And our vision is St. Luke's Health System will transform healthcare by aligning with physicians and other providers to deliver integrated, seamless, and patient-centered quality care across all St. Luke's settings. So, let me talk to you about what goes into accountable care. Our strategy for realizing our vision and better serving our mission is accountable care, which may mean different things to different organizations. But to St. Luke's, accountable care is the triple aim of better health, better care, and lower cost. So let me show you how this all comes together. Look at this slide that demonstrates value in the very center. That's what we're trying to create, is value for those we serve. We think that value is delivered by accountable care, which is made up of better health, better care, and lower cost. So let's look at some of the things that we've been doing and see how they relate to this. As we look at better health, we can consider our Healthy You program, which is already working to improve the health of our employees. And now we have something that we can deploy to other populations and other companies. In addition, our Select Health relationship. Why is this under Better Health? Because for the first time, Select Health gives us a financial mechanism to invest in health. And I'll explain about that later. Let's look at Better Care. There's a number of things that St. Luke's is doing to improve the care of those we care for. We have the Regents Blue Shield Healthy You Co-Partner Program. This is an innovative program that we work together with Regents to focus on those populations of patients with highest cost that typically have chronic illnesses. And we now are deploying ways to manage and better coordinate that care to improve better care, but also to drive lower cost. Clinical integration. This is how we're going to work with independent physicians to bring them within our network so that we're sharing best practices and able to offer a product to all patients that we serve. Our My St. Luke's implementation is the foundation of accountable care and will contribute to better care by making sure that everyone in our network has access to the patient information. And our Humphreys Diabetes Center, which is going to help us to deliver disease management to those patients with diabetes to better control their disease and to improve their outcomes. And then as we look at lower cost, for example, our teamwork implementation of Lean throughout St. Luke's Health System, where we will focus on standardizing our processes and eliminating waste to reduce inefficiencies and unnecessary cost throughout our health system. Our EICU, which is a grant that we received from the federal government to implement an electronic telemetry system that allows us to work with our rural hospitals to help improve the care of very sick patients who are in those outlying facilities. And our Center for Spine Wellness, where we evaluate patients with back pain to determine if non-surgical approaches could best manage their care without having to incur the cost and the difficulties associated with surgery. And our Medicare Shared Savings Program, which we will begin in January, where we will work with the federal government to manage a population of Medicare beneficiaries against 33 quality measures. And if we are successful in lowering the cost to care for that population, St. Luke's will share in the savings. People throughout our health system are working to help us achieve the triple aim. Better health. For example, all the people who work in sports medicine, those who provide health fairs and education, the folks who work in the Breast Cancer Detection Center, our dietitians, and of course our health coaches. And better care. A great example of this is the stroke work that we're doing in the Treasure Valley and Magic Valley, and how we'll be able to take evidence-based practices and best practices and offer those to our rural settings through the implementation of EICU. And lower cost. That's exemplified by the work of everyone in supply chain management and the great work being done with teamwork, our implementation of lean throughout our health system. And I'll have much more to say about that. And also to everyone who washes their hands between patients, who follows a checklist, or who got a flu shot, so that we can prevent every possible infection that we might give to a patient and every avoidable complication. We are so fortunate to have an outstanding System Chief Operating Officer, Gary Fletcher. Here he is to tell you about some more of our efforts.
Hello, I'm Gary Fletcher, St. Luke's Health System Chief Operating Officer, and I'm pleased to be here today to visit with you about this past year, the challenges we've had, and the opportunities we have for the future. The work I do is lead the oversight of operations for the St. Luke's Health System. We've organized a Systems Operations Council that has representation from throughout the system, including the CEOs, finance, physician services, performance excellence, and regional services. And we've started to identify gaps in the areas of quality and service, efficiency, and cost reduction. Now on to the results for this year. We've had an interesting year, and here's what we saw. Revenue was up and down, except in Magic Valley and Good Work Magic Valley. We saw a steady increase, but throughout most of the system, revenues were pretty volatile. For the reasons, we're not quite sure, but we think they come from the economy, people being more conservative. Secondly, taking better care of themselves, which is good and which is where we're headed. Third, we've seen a big shift to outpatient utilization instead of inpatient care. So this may well be the future. Having said this, the results that it produced are as follows. We had a challenging first two quarters, and at the end of the first two quarters, we were not meeting our targets. We're shy by about $15 million. Now, $15 million isn't the end of the world. However, that's $15 million less that we have to spend on equipment, people, programs, and services going forward. We took a close look at all of our expenses, labor, supplies, contracts, travel, and everything, and made adjustments. And as we got into May, we thought we were clawing our way back toward our targets. But June was another story. We had a significant decline in volumes during June. We think part of it was attributable to our EPIC implementation, and so it required that we enhanced our efforts to analyze expenses and adjust them in accordance with the volumes. And let me give you a couple ideas of things that we are working on. COPAR, for example, is the effort to look at how we take the best possible care efficiently of patients who are most at risk. These are patients who have significant medical conditions, multiple medical conditions, and need a team, multidisciplinary approach. Secondly, we're paying significant attention to supply chain management, where we are looking at how we both acquire and manage our resources, those being supplies, equipment, contract services, and all the things we utilize in taking care of our patients. We're looking at how we acquire them at the best cost, and secondly, how we apply them in a way that we're most efficient. For next year, our challenge is even greater because we have performance targets that exceed what we had this year. Our targets for next year are cash flow for $170 million, and in order to achieve that target, we must save, be more efficient to the extent of $35 to $40 million. We can do this. We can do this by continuing to manage resources as we have been this year and beginning to apply to a greater extent teamwork, which is our approach to lean. We are transforming healthcare to focus on better health, better care, and lower cost. In order to meet this objective, we've got to be successful in meeting our operating targets because it's these resources that we need to invest in equipment, people, services, and processes that will help us produce better health, better care, and lower cost. Let me give you a personal example of some of the good work that you're doing. My wife and I, Carolyn, are among the elder statesmen of the St. Luke's leadership team. Don't tell her I said that. And so we tend to see some of our providers more. Recently, she had a condition that required she see one of our specialists, and that specialist was able to sit down with her and pull up on Epic all of the diagnostic tests that have been done over the last couple years and review with her the results and order additional tests, and pretty much in a very short period of time diagnose her condition and sent her on her way to get better. Now, that process was more efficient, required less time, and didn't duplicate tests that might have had to have been duplicated before, so it's an example of the good work that you're doing in developing our system, and we thank you very much.
Gary brings up the work we are doing around our own employees' health. Healthy You is so important because not only does it give us a healthier workforce, but it has served us as a pilot for us to develop the competencies and capabilities to manage the health of other populations, a key component of accountable care. This is now a program that we can take to other employers as a model for how to keep their employees healthy, help their employees remain more productive, and help control their health care costs. We are also partnering with Regents Blue Shield of Idaho on COPAR. That stands for the Care of Patients at Risk. This is a medical home model applied to the management of high-risk, high-cost patients. It involves the care coordination of these patients to see whether we can produce better outcomes at lower cost. We have long said that the current fee-for-service reimbursement system rewards ill care rather than wellness. It incentivizes volume of services over value, and it fails to reward better outcomes. To drive the clinical model transformation that we envision with accountable care, that, for example, wellness promotion, care coordination, management of care transitions, we must be able to have a new reimbursement model. We are designing that, an innovative payment model in collaboration with Select Health that we recently publicly announced. I want to explain how this works so that you can appreciate how it will help us succeed in providing accountable care. So here's how it works. If you look at the left side of your screen, under traditional insurance, about 20 cents of every premium dollar goes to pay for the administrative costs of the insurance company, for money that they set aside to cover for risk. And then if you look at the rest of the 80 cents of that premium dollar, that goes to cover healthcare claims from hospitals, physicians, and other providers. Now if you move to the right side of the screen, now just 10 cents goes to the insurance company. That will cover their administrative costs and the profit margin that they need to reinvest in their own systems and processes. We still have the 80 cents that goes to medical care, paying those claims, but now there's 10 cents left over. And we can do two important things with that. As I've said, if we really want to lower the cost of healthcare, we've got to invest in keeping people healthy. So part of that 10 cents will go to programs to keep people healthy. The other part is, if we want physicians to move away from the volume of services to the value of services, we have to have a way to keep them whole as they reduce the volume of services and expensive tests and procedures that they perform to only those that are going to provide true value. So this new model allows us for the first time a way to actually make it financially work for us to invest in lowering cost. The platform that serves as the infrastructure and foundation for all of our efforts to provide better care at a lower cost is the My St. Luke's. I want you to hear from our Chief Medical Information Officer, Dr. Mark Chasen.
Hi, I'm Mark Chasen, St. Luke's Health System Vice President and Chief Medical Information Officer. I want to catch you up on some of our initiatives. We're making exceptional progress with implementing My St. Luke's, our electronic health record. We're implementing this system in waves with groups of physicians in each wave. After each wave, we hold a review session to discuss what went well and how we can improve for the next wave. Some of you may not know that the Integrated EMR initiative was started by our System Physician IT Steering Committee. They developed a recommendation to St. Luke's senior leadership that we implement a fully integrated electronic medical record throughout the health system. One of our committee members, Dr. Robert Smith, attended our most recent review session, and he listened to the group discuss what needed to be improved the next time. He is currently using the system, and as we wrapped up the conversation, he stood up to tell us about one of his patients. His patient has a complex set of medical problems, and Dr. Smith told us now that his patient's cardiologists and rheumatologists are on the system. They are all better able to coordinate, communicate, and reinforce the work they are doing. He told us now he is able to keep the other doctors caring for this patient informed, making all three of them far more effective. Dr. Smith told us how the patient now hears consistent, coordinated messages from each of his clinicians, and that gives him the assurance that he is getting the best care available anywhere from a highly competent, highly coordinated team. He also told us how his patient went home and immediately activated his MyChart account. When Dr. Smith changed one of his medications based on a lab result from that recent visit, he was able to convey this to his patient and also very quickly to his care team. This kind of experience inspires all of us as we continue the implementation. Our revenue cycle, health information management, and patient access teams are all using My St. Luke's, and work on our ambulatory sites is continuing, with the system expected in all of our clinics next year. We're continuing to improve as we go. It's meant new habits, new ways of working, and lots of patients as staff and physicians learn and adopt the new system. We're adjusting our training and implementation plans as needed to improve our processes and make things easier for our physician partners and staff members. And we're already seeing the benefits for patients. We're hearing about how much our patients appreciate access to MyChart, their online medical record, and their primary care and specialist physicians appreciate the new level of information and integration in the chart. We've had a fantastic working relationship with our vendor and contractors, and they say our implementation is among the best they've seen. That's due to all the great folks and great attitudes at St. Luke's. So many of you have done so much work to build the system, to test the system, and to learn the system, and on behalf of the sponsor group, I wanted to say thanks for all everyone has done. I also wanted to tell you that we're also preparing for another significant change that is coming our way. St. Luke's, along with all the other healthcare systems across the country, is gearing up to transition to ICD-10, the 10th revision of the global standard of diagnosis codes set by the World Health Organization. Here's why it matters. The ICD-9 set of diagnoses and procedures has been with us for 35 years, and we use these codes for billing. Among other things, ICD-10 is going to add thousands of new codes, new names for diseases and symptoms, and new names for treatments. ICD-10 represents the many advances we have seen in medicine over the past 4 decades. It means better precision and better documentation. And the scale of the switch is big. Our physician partners and employees in our St. Luke's clinics, all the folks in health information management and billing, and everyone involved in treating patients will be learning about the new codes, which will let us improve our reporting and better track health patterns in our communities and region. ICD-10 is also critical to our revenue cycle. These codes have everything to do with how St. Luke's and other health systems get paid. And the ways we approach our job will change. Work has begun to bring our technology to the level needed for ICD-10 to serve us. We have over 60 applications that need to be upgraded to get our system ready. Medical Records is implementing clinical documentation improvement to make sure that we're capturing all the data needed to support the new codes. We're reviewing our billing and working with payers to see how our claims processes will change. And we want to make sure our ICD-10 educational materials meet our employees' and physician needs. There's a lot of preparation and assessment needed to be ready for ICD-10. We'll conduct training throughout the early part of 2014 and run many scenarios to make sure the transition goes smoothly. ICD-10 will go into effect across the country in October of 2014. It's a complex project, and we're getting started now to be sure we're ready for the challenge. My St. Luke's and our ICD-10 work are critical for us to make the progress we want towards the triple aim, and our goals of better health and better care especially. Many of you are involved in these projects, and I want you to know that you are part of an important transformation that is part of our vision for the future. At a recent board meeting, one of the board members told the group how important our new integrated EMR has been to a family member. We can all be proud to know that we are making a difference to our patients and their families with the work we are doing. I am grateful to be able to share all of our progress with you today and to celebrate all the fantastic work you are doing. Thank you.
A recent Harris Interactive poll of consumer satisfaction with retail experiences showed that the most satisfying last visit that anybody made was to a restaurant. Then after that, to a department store. Then after that was a bank online purchase. And then healthcare providers came in fourth. The good news is we beat out hotels, auto purchases, health insurance purchases, and mobile phone stores. But we have to be focused on how do we improve the patient experience. A recent Robert Wood Johnson Foundation study showed that 90% of patients would like to see their health records. Other studies showed that 85% of patients want to communicate with their physicians by email. Half want to be able to schedule appointments online. But these same people said that only 10% of their current physicians offered those services. This is a huge opportunity for St. Luke's. My chart is making a difference already. It's better coordinating care among specialists and primary care physicians. We're avoiding potentially dangerous medication interactions, and we're giving patients what they want. And I'm so excited about our My St. Luke's app. This is mHealth, or mobile health. This is innovative, and it's a powerful patient engagement tool. In fact, just last week, I used it to email my physician. I was really suffering with my allergies. I was taking over-the-counter medications, and they weren't working. So I just pulled up my St. Luke's app, and I typed into my primary care physician a message, and I said, I'm suffering with my allergies. Here's what I'm taking. I'm wondering if I'd benefit from this. The next morning, I had an email from my physician saying, yes, he agreed, and he'd called in the medication to the pharmacy for me. This saved me time and money. It saved me time in that I didn't have to call the physician's office, talk to somebody who would convey the message to his nurse, who would convey the message to the doctor, who would then later get back to me. And it saved me money in that I didn't have to take off from work and go into the doctor's office. It was a simple enough problem to take care of over email. So this is lower cost, and it's patient engagement. In fact, I love my chart so much that I probably won't go to a physician who's not on it now. So let me take a minute and talk about Nampa and Fruitland. I don't want there to be confusion. It is important that we have primary care, imaging, urgent care, and treatment centers in all the areas we serve. But we won't necessarily need hospital beds. But where we do, we are only building half the number that we would have in the past due to our anticipated success in our new accountable care model. Nampa and Fruitland are two such areas where it is important that we have a physical presence. And the response that we have received from the people of Nampa and the surrounding areas that have visited our Nampa Medical Plaza has been overwhelming. Let me also mention about Jerome and Elmore. We're thrilled to have Jerome join our health system last year, and we look forward to Elmore joining next year. I have often been asked, why are we adding critical access hospitals to our health system? The answer is simple. They are not only resources and sources of employment and economic drivers in their communities, but they are a local presence in rural areas of Idaho that is essential for us to be in to meet our goal of population health management. You see, if we are going to implement accountable care, we have to be able to manage the health of a population of people, some who aren't even patients yet. And to do that, we have to put in preventative measures, manage disease more effectively, and coordinate care. We have to be in the communities where these patients live and work to do this. Otherwise, care will continue to be fragmented, and patients will end up in our medical centers where their care is more expensive and associated with higher morbidity and mortality. Speaking of morbidity and mortality, let me share just a little bit of the good news that we have received from our latest health grades ratings. Treasure Valley was the recipient of the Critical Care Excellence Award and named one of America's 100 best hospitals for critical care. Treasure Valley also received 5 stars. 5 stars means better than expected, statistically better than expected outcomes. And we got it for the treatment of stroke, heart failure, chronic obstructive pulmonary disease, bowel obstruction, pancreatitis, and pulmonary embolism or blood clots. Also, Treasure Valley ranked #1 in the state of Idaho for spine surgery and the treatment of GI disorders. I'm so proud of those accomplishments. And Magic Valley received 5 stars for the treatment of stroke and for the performance of carotid artery surgery. Be sure to check out my blog for a detailed report from Dr. Bart Hill, our System Chief Quality Officer, about all of our health grades ratings. Now I want Jeff Taylor, our System Chief Financial Officer, to provide you with an update.
Hello, I'm Jeff Taylor, St. Luke's Chief Financial Officer, and I appreciate the opportunity to speak with you today. Given my role, I'm often asked, how is St. Luke's doing? I'm happy to report that we're actually doing quite well. We are also very well positioned to deal with the future. So first, how are we doing? This last summer, both Moody's and Standard & Poor's reaffirmed our A rating. This affirmation occurred after an in-depth review of our financial position, historical performance, strategy, and market position. As part of this rating process, we sold bonds in the amount of $150 million to capitalize on an extremely low interest rate environment. The demand to purchase St. Luke's bonds far exceeded expectations, confirming that, on a national level, others believe in the strategy and creditworthiness of St. Luke's. These offerings can be very complicated, and you should all be thankful that our internal finance team enjoys this kind of work. From an operational perspective, over the last several years, our margins have remained stable, and we are experiencing cost improvements in many areas across our organization. Examples include lab, laundry, insurance, and billing. In addition, we've deployed sophisticated data tools that are improving our ability to monitor operations, revenue cycle activities, and patient quality outcomes. We continue to gain efficiencies in all that we do. These efficiencies, which help us to budget and plan our finances with increasing precision, are critical as we work toward our triple aim of better health, better care, and lower cost. Lastly, as you're aware, healthcare costs continue to increase at unsustainable levels. There are a number of contributing factors, one of which is the underlying payment system between payers and providers. We've been working hard to become more aligned with the provider community, and we believe now is the time to become more aligned with the payer community. We've executed a contract with Regents of Idaho that rewards our system for identifying high-risk patients and pursuing innovative changes aimed at lowering the overall cost for that population. Most recently, we formed a strategic affiliation with Select Health and are actively working with other commercial and governmental payers to pursue similar alliances, all aimed at transitioning away from a payment system that rewards providers for volume to a payment system that rewards for value. I want to leave you with a little story about my grandmother. She's 96, still lives at home, very active, great health, and as sharp as can be. I'm the second oldest of 26 grandchildren, and she is a great-great-grandmother to my two beautiful granddaughters. A few years ago, she asked me, "Jeff, are you still the accountant for St. Luke's, and do you still work downtown?" "Yes, Grandma." "Exactly what do you do?" I told her I help lead and guide St. Luke's in making financial and other decisions that are in the best interest of our patients and the communities we serve. My grandmother is proud to have me in this role as the accountant for St. Luke's, even if my title is a little bit different. And I'm proud and honored to be in this role on behalf of all of you. I believe we all share an obligation to be good stewards of this great community asset for the benefit of our patients and their families. I'm confident in our collective ability to do so based on our history, and I look forward to the future. Thank you for your time and attention today and all that you do every day for St. Luke's and our patients.
We have accomplished an amazing amount over the past 3 years, and I'm so proud of every one of you. While it may have at times seemed like one-offs, or that administration really couldn't make up its mind about where we needed to focus our time and attention, everything we've been doing has been preparing our capabilities and competencies to deliver accountable care to large populations of people. Much of what we have done is innovative and unique to St. Luke's. We are already well on our way to our goal of being a national leader and leading the way to fixing what is wrong with healthcare. I can see what this looks like as it all comes together. It's becoming so clear to me. I hope you are as excited as I am. Together with our physicians and our providers, we are transforming healthcare to deliver integrated, seamless, and patient-centered quality care across all of our St. Luke's settings. We have come so far, and we are getting better every year. We have instilled individual accountability, and we have made great progress with team accountability. Now, I am starting to see examples of cross-functional accountability throughout our health system. This is when teams realize that they exist to serve others and actively work to leverage the capabilities of a team with other teams. We have reached this level of accountability in just 3 years, which is remarkable. Many other organizations never achieve this, and you can tell because they operate in silos. The highest level of accountability is organizational accountability. This occurs when every employee understands the organizational goals and their role in achieving the goals. So, this year, we are working toward this by simplifying the goals and focusing everyone's efforts on them. For fiscal year 2013, there are only 2 goals, and these will apply to everyone. That is to create an exceptional patient experience and create exceptional outcomes through teamwork. If we all work to create an exceptional patient experience, we will create patient loyalty. We will attract new patients, and we will better engage patients in their own care. The team in teamwork stands for timely, effective, accountable, and measurable. When we create exceptional outcomes through teamwork, we work together as a team to make sure that we deliver value to all of our patients, their families, our colleagues, and our communities. It's wasteful when we don't add value to the patient's care. The Institute of Medicine recently determined that perhaps as much as 1/3 of healthcare costs are waste. No value or even no value. It involves duplication, things that are causing avoidable harm, things that don't coordinate care well enough to avoid unnecessary complications or repeat hospitalizations. We all know that we can be more efficient and that we can get better results. We need our frontline employees to help us identify those opportunities so that we can eliminate inefficiencies or at least decrease them. When we make our operations and care more efficient, we help to reduce healthcare costs, and that's a significant part of our triple aim. This has been an incredibly exciting year, and I know everybody is working really hard, and I thank you for that. But most importantly, all of the patients and the families that we serve will thank you for the efforts you're making. We are transforming healthcare. Thank you very much.